Welcome to this anatomy module on the lymphatic system. Here we're going to talk about the anatomy of the lymphatic system itself, the various vital functions that it provides for our bodies, and what, if any, impact massage has on the lymphatic system. We'll also talk about how the lymphatic system integrates with the other systems in the body to create that homeostasis or well-being balance. The lymphatic system has three vital functions. One, the removal of excess tissue fluid, filtering fluids to help fight infection, but it also plays a role in aiding digestion. So straight up there, integrating with a number of other body systems. Firstly, in terms of removing excess tissue fluid, or what we call the interstitial fluid, which we've talked about in a number of the modules. As the lymph moves around the system, it can remove excess fluids and the excess proteins contained within those interstitial fluids for redistribution or excretion from the body. Lymphoid tissue within the lymph node itself produces but also stores the lymphocytes, which are a type of white blood cell, and these play a role in fighting infection. As the lymphatic system filters those interstitial fluids, they remove foreign agents that may cause infection in the body, and also plays a role in delivering these lymphocytes, this type of white blood cell, to the parts of the body that need it to fight infection. In terms of digestion, an unlikely role, or maybe unintuitive, but the lymphatic system absorbs fats from the small intestine and carries those fat cells and large particles to the liver. So let's look at the overarching anatomy of the lymphatic system, and then we'll deep dive into those specific organs where you need to know a little bit more. So I always think, looking at the lymphatic system, it looks quite similar to the cardiovascular system, as in it's a system-wide network of capillaries and vessels. But there are a number of key differences. For example, it lacks a pump. The cardiovascular system has a heart to pump the fluids, the blood, around the body. The lymphatic system doesn't have a pump. It's movement, contraction of the muscles that helps move that fluid around. So what are the key organs of the lymphatic system? So as we've mentioned, this network of capillaries and vessels, the lymph nodes, which you can see here as those round nodules. There are a number of groups of these nodes around the body, and their names is related to where they are found. They're cervical lymph nodes. The clue is in the name. The cervical vertebrae in the neck, cervical lymph nodes. We then have the axillary lymph nodes in the armpit, and we have the inguinal lymph nodes in the inguinal area. And behind the knee, we have the popliteal lymph nodes, the popliteus, that muscle behind the knee. In addition, we also have ducts within the lymphatic system. The thoracic duct in the thorax. And we also have the right lymphatic duct in the right quadrant of the torso. The spleen, we're going to talk about in more detail. But the thymus, as well as the tonsils, are also part of the lymphatic system. Lymph is a milky but clear, pale yellow bodily fluid, mostly made up of interstitial fluid. But it also contains those excess proteins and particles that it picks up along the way, and lymphocytes, this form of white blood cell that's created within the lymph node. 2 to 10% of the interstitial fluid reabsorbed by the lymphatic system as lymph. So the lymph itself is made up of this fluid that it picks up along the way. That lymph is stored within the system for return to the bloodstream, so plays a key part in this fluid balance that we've talked about across the body. If more fluid is needed, it can be reabsorbed into the bloodstream for distribution around the body. This flow, this manual pumping of the lymph around the body, allows the body to eliminate products of cellular breakdown, like these excess proteins, fat particles, or even helping with bacterial invasion.
The lymph node is bean-shaped, and each node is around 1 to 2 centimeters in size. They filter and purify the lymph, as well as create the lymphocytes, those white blood cell-like cells that we mentioned. So as you can see, they have an entry and exit points to allow that to happen. When there's infection in the body, these lymph nodes tend to enlarge. So people will often talk about those swollen lymph nodes in the body when they are ill. There are 400 to 700 lymph nodes found in the body, with 170 to 200 of those found in the neck. 50% of them are found in the abdomen. So the lymph ducts, capillaries and vessels. So similar to the cardiovascular system, the lymphatic system transports lymph fluid around the body via a network of vessels, capillaries or ducts that resemble veins. But there are a number of key differences. One, they tend to be larger, and two, the outer membrane is highly permeable, allowing the fluids and large particles to move easily in and out of the system. So, as like this image here, as the pressures change, fluid moves in and out of the system. So the ducts are where the capillaries run together and intertwine with the arteries and veins of the cardiovascular system, allowing, where needed, excess fluids to move from one system to the other and back again to help maintain that fluid balance in the body. The right lymphatic duct serves the upper right quadrant, and the thoracic duct drains the rest of the body. So without the means of a pump in the body, how does the lymph move? It is largely through muscular movement, the contraction and relaxation of the muscles and the soft tissues in the body that creates this pump effect that gets the lymph moving. The lymph only moves in one direction, again another key difference from the cardiovascular system. And it contains a number of valves within that system to allow it to keep moving forward towards the ducts. These valves also have a muscular element that contract and relax, creating this push and pull, vacuum and push element to the system. So it's a combination of this valve design and the movement of the muscles of the body that help the lymph move around the body. The spleen is the largest mass of lymphoid tissue in the body, and it's located in the upper left quadrant of the abdomen and lies in contact with the stomach. It is composed of two types of tissue, white pulp and red pulp. The white pulp contains a large proportion of lymphocytes and macrophages, giving it this white appearance. And although the red pulp also contains macrophages, lymphocytes, those white blood cell type cells, it also contains red blood cells, giving it this red colour. The spleen removes old red blood cells from the system. So as we've mentioned through the other slides, the lymphatic system is a key integrator with other systems in the body. Firstly, with the cardiovascular system, it returns and also removes excess proteins to the blood and is a key part of maintaining the fluid balance across the body and in the blood. So as the lymphatic system, through those ducts, intertwines with the arteries and veins, that fluid exchange takes place. The lymphatic system is vital for the immune system. One, in the creation of lymphocytes within the lymph nodes, and then the distribution and delivery of those lymphocytes around the body to where they're needed. And also in removing foreign agents from the body. With the muscular system, again, the lymph wouldn't go very far without the muscular system. This contraction and relaxation of the muscles, creating that pump, that constant movement and flow around the body. As the muscular system creates waste products, and these come into that interstitial fluid, the lymphatic system plays a key part in one, creating a removal system for those, but also in creating that balance from those fluids. Again, having a knock-on impact on the ion balance in the body. In terms of digestion, as the lymphatic system moves around the small intestine, it can absorb and remove these fat cells and large particles and return them to the blood or to the liver. Common pathologies that may present in your clients. The first being edema, which is swelling in one or more parts of the body, often characterized by discoloration of the skin, puffiness, tenderness in the limbs and joints if the swelling or edema is around a joint, and also weight gain. Mild edema tends to go away by itself, but severe or acute edema is often treated with drugs. It's not a contraindication, but if your client is in pain, be aware to support them with pillows to modify pressure and ensure that they're not in pain during treatment. Hodgkin's disease is a painless swollen lymph node, usually found in the neck, armpit or groin. You should seek medical advice and GP approval. Short-term massage avoiding the area is currently advised by the Lymphoma Association. But if in doubt, always ask for GP approval. Lymphedema, this is swelling in all or part of a limb or another part of the body. The limb is often much bigger, heavy, hard, tight skin around it, and there can also be leaking fluid from the skin. This is a contraindication for general massage, but manual lymphatic drainage, if qualified in this technique, can be used. So what does this mean for massage? As we said, there's very limited research that massage can improve lymph flow in the body. There are a number of studies that show some impact, but many that show there is not. Movement, gentle exercise, stimulates the lymphatic system. And if you think about what we do in terms of our touch, it is likely that we're not creating as much pump and flow as some gentle exercise itself would produce for the client. But it has been shown that massage can aid in the reduction of leg edema following fractures as part of a multi-treatment approach, including exercise. Again, because that study involves a multi-treatment approach, it is unclear whether the massage itself had a direct impact. There are specific techniques, one being manual lymphatic drainage or MLD, which you must be specialist trained in, where there is some more evidence of it being effective, especially in things like breast cancer treatment recovery. Some studies have also shown that MLD following exercise can reduce the serum levels of muscle enzymes, which may or may not indicate improved regeneration of tissues.